John Essler had a minimally invasive TAVR procedure to treat his aortic stenosis.
No pain at all. And as a matter of fact, surgery was Thursday. Friday I was released. Saturday I was walking and biking.
He then enrolled in Lee Health's cardiac rehab program.
It's a total rehab program. It's not just physical, it's mental.
Cardiac rehab is for patients who have had some sort of heart surgery or a stent.
Research shows that if you complete a cardiac rehab program, you have reduced chance of mortality or morbidity, you feel better, you have a better quality of life, and you feel stronger as well.
Patients typically come rehab 2 to 3 days a week. Monitored exercise is just one of the ways nurses like Jennifer Trantina helps them recover.
We aim to get cardiac patients stronger after recovering from a heart event.
They're looking at your heart rate, your blood pressure, and things like that.
Another major part of the program is education.
They're saying, well, maybe you should try this or this or this. So, less red meat, more vegetables, more fruit, trying to avoid starches.
Essler says he's now feeling better than ever. You can learn more about cardiac rehab by searching for it on leehealth.org. For Lee Health, I'm Devin Turk.